Conference, we're moving to F13, speech by Joan Walmsley. Joan was appointed to the House of Lords in 2000 and this summer was appointed our Health and Social Care spokesman. So please welcome Joan Walmsley.
Thank you, Chris. Fellow Liberal Democrats, it is often said that the first responsibility of a government is the safety and security of its citizens. But surely the responsibility to help people lead a happy and healthy life is equally great. Of course, our health is a personal matter, and when we need treatment or care, we should be empowered to make our own choices wherever possible. That is the Liberal way. But health is also a community and a government responsibility. Health affects everything. It affects how long we live, our well-being, our achievements, economic and otherwise, our family life, our contribution to society, and of course our happiness. And yet, we hear increasingly worrying reports about the capacity of the NHS to cope with demand. The NHS, a world-renowned institution of which we are rightly proud, is struggling. Some say it has become a sickness service rather than a health service, spending a huge amount of resource firefighting preventable diseases, dealing with the complex needs of an aging population, providing ever more wonderful but expensive medicines. The pressures on NHS staff are enormous. And it seems that no matter how hard they work, how much they care, and how much the government spends, it is never enough. However, the NHS is incredibly cost-effective. Last year, the Commonwealth Fund compared the UK with 10 other advanced economies. And despite the UK spending the next to least per capita on health, the NHS was top in the overall rankings. We do well on the quality of care, access to care, efficiency, and equity. However, we were next to bottom on living healthy lives. Clearly, unless we can turn around our public health and well-being problems, we will continue to lead unhealthy lives, and the pressure on the NHS will continue. My view is that a large part of the solution is to adopt a far more rounded approach to public health and prevention, to stop dealing with health policy in isolation when its implications are so widespread. Health should be a whole government responsibility, not just the job of the Department of Health. Suggesting that health is just the responsibility of the NHS is like expecting the goalkeeper to win the match on his own without the help of the other players. It should be obvious that the rest of the team should play their part too. The resource pressures on our health service should not be underestimated. The NHS Chief Executive has predicted a black hole of £30 billion by 2020. And so while I call on the Chancellor to make a more realistic investment in the NHS, I am also calling on the whole government to contribute to the health of the nation. The keys to beating this challenge are integration, prevention, innovation, and what I would call getting it right first time. Public Health England recently estimated that 40% of ill health are due to diet and lifestyle and is therefore preventable, so that is where attention should be focused. We have a country where too many people are poor and disadvantaged. There is no greater factor contributing to ill health, mental health. Is it any wonder that people from disadvantaged backgrounds have poorer health and shorter life expectancies? According to Sir Michael Marmot's recent book, 200,000 people are dying prematurely every year in the UK just because they are poor. And it cannot be right that our child mortality rate is one of the worst in Europe. Dealing with the economic divide would go a long way to improving the health of the country. What can the Department of Education do to help lift the burden on the health service? The foundations of a healthy life are laid in childhood, so it has a key role. Liberal Democrats support a national curriculum which includes personal, social, health and economic education in all state-funded schools. In government, we continued to put pressure on the Conservatives, but they responded only with warm words, so we still fall far short of what young people need: good quality health education, including sex and relationships. Personally, I believe it's the right of every child to receive life-saving and life-enhancing information. It matters for their future health and happiness, and I think we owe it to all of them. Children need to know about respectful relationships, how to protect themselves from abuse and violence, about sexually transmitted diseases, the effects of smoking, drugs, and alcohol, and how to avoid unintended pregnancies. They also need to know something about positive parenting long before they become one. And they should also learn about a healthy diet. It is positive that now schools teach some cooking, but it's not enough. This is really important, particularly for those on low incomes. After all, potatoes are cheaper than oven chips, and we know what's in them. I was delighted that the Liberal Democrats in government introduced free school meals for the under-7s. It is an evidence-based policy, but it is now under threat from the Tory government. School meals have to reach good standards of nutrition, and by providing them free of charge, we can ensure every child benefits. This is a terrific achievement of the Lib Dems in government, and we will oppose any threat to it. Of course, a love of sport is often developed at school, but many children who enjoy sport drop it as soon as they leave. And this is where the Department of Culture, Media and Sport, local sports clubs and local government come in. Physical activity is a vital ingredient of a healthy lifestyle and a major contributor to avoiding obesity, diabetes, £5 billion to start paying for it. These services had been sadly neglected for years, and we can be proud of what Norman and Nick did. Setting children on course for good mental health prevents many problems, both mental and physical, in the future. Liberal Democrats will continue to hold the Tories' feet to the fire to ensure that funding doesn't disappear and indeed comes through early in the Parliament. Young people need that money now. Childhood can be a tough time. Learning who you are as a person and dealing with the pressure of exams, social media, peer groups and families is very challenging for young people. The task force recommended that schools should actively promote children's mental health in their PSHE lessons, teaching pupils how to cultivate their own mental health, recognising stress and taking action to reduce it, giving them the self-confidence to ask for help when encountering bullying and abuse. But schools need funds to train staff to help them to recognise mental health problems and signpost children to appropriate services. And we mustn't forget what the Liberal Democrats did in government for children with physical or mental disabilities and learning difficulties. Our pupil premium has helped schools ensure that special arrangements were made for all these children and for those from disadvantaged backgrounds to help them realise their potential. And it's now being extended to the under-5s, thanks to David Laws. A good start for a baby depends on the health and well-being of its mother and her ability to bond with her child. But perinatal mental health services are patchy. So I join with Norman in calling on NHS England to set a standard and ensure it's delivered. Early physical health also needs attention. Last year, the Royal College of Paediatrics and Child Health and the NCB reported that UK children are at a higher risk of premature death than their Western European counterparts due to the growing gap between rich and poor and a lack of targeted public health policies. But they challenge the idea that if a child is born into a low-income family, he's automatically on a pathway to ill health. This simply isn't the case. Areas such as Hartlepool and Islington are demonstrating that with targeted support, every child, no matter where she lives, has the potential to be healthy. So why cannot we do it everywhere? I join with the Royal College and the NCB in urging the government to implement a new child health strategy which learns from the best and takes a joined-up approach to health, education and social care to help tackle health inequalities at source. Furthermore, help with childcare costs for working parents can help take children out of poverty. In government, we provided more support for parents who were struggling to meet the costs of childcare, and our manifesto promised more. Unfortunately, the Conservatives' cynical election pledges are proving undeliverable. Primary schools have now joined with private nurseries in warning the government that more funding is needed. Otherwise, they will have to cut the number of free places. The government must learn that you can't get something for nothing. Good quality childcare, so important for the health and development of all children, does not come cheap. The government's childcare policies must be appropriately funded, or they could do more harm than good. Local authorities, with their unique knowledge of the communities they serve, are ideally placed to develop interventions which will improve health outcomes. By giving councils responsibility for public health when we were in government, we were opening the door for a huge step forwards in public health provision. And yet, within a month of being in power on their own, the Conservative government announced an immediate £200 million cut in public health funding. How disgracefully short-sighted. This government must understand that investing in public health isn't a luxury. It is absolutely essential. Both the health of people across the country and the sustainability of the NHS will depend on public health programmes, preventing the conditions that are straining its resources. Local authorities must also play a role in adult mental health because, as we all know, there's a strong link between mental and physical health. Another area where there are huge health implications is housing. The very young and the very old are most endangered by poor housing. Cold, damp homes foster colds, bronchitis, and many more problems. We need many more decent, affordable homes for families and smaller, well-insulated homes for older people to move into when the family has flown. Here is where successive governments have failed for decades, and as the cost of energy has risen, even people who have decent homes are finding it hard to heat them. We know that the most cost-effective way to reduce energy bills is good insulation, but much of our old housing stock is poorly insulated. The Green Deal Home Improvement Fund, launched by Ed Davey as Energy Secretary, provided funding for tens of thousands of families to make energy efficiency improvements to their homes, making them greener, cheaper, warmer, and of course healthier. But the government has decided to stop financing the Green Deal Finance Company. Where now will people get health to make their homes warmer? Employers, too, can have a really positive role in ensuring the health of their workers. And the Department of Business Innovation and Skills could do more to incentivise all employers to copy the best. For example, Ginster's Pies have an award-winning scheme called Active Workplace, in which 85% of its workforce take part. They offer healthy eating advice, workplace-based exercise classes, enjoyable activities for the whole family, and the help to quit smoking. Ginster's programme has made a big difference to the number of days off through sickness. Imagine what the effect would be on national productivity if every employer did something like this. How about some tax incentives to encourage them to do so? Of course, BIS also has a role working with the pharmaceutical industry to deliver innovative medicines, technologies and therapies. Vince Cable, as Business Secretary, took steps to support medical innovation, including the introduction of the Early Access to Medicine scheme, which enabled patients to get new treatments faster. I call on the government to maintain the momentum of this programme. The Department of Transport does not escape responsibility. The lack of clean air in many of our towns and cities causes major problems for asthmatics and others. Indeed, every year there are an estimated 29,000 early deaths in the UK because of air pollution. Transport policies, therefore, play a part, from fuel duties to subsidies for green cars to provision of affordable public transport, and so on. Ed Davies' efforts to increase the amount of renewable energy production in the UK is something we can all be proud of. It has reduced our reliance on polluting coal-fired power stations, all of which helps with clean air. But the latest action of the Conservative government has been to reduce subsidies for onshore wind and solar power, putting our health at risk as well as our decarbonisation targets. Norman Baker launched the coalition government's programme to drive forward the development of ultra-low emission vehicles with £500 million of funding to make Britain a leader in these clean technologies. But people won't buy these cars unless we have a much better infrastructure of recharging points. And this requires urgent government action. And where does the welfare system come in? Universal credit, by helping people back to work, is intended to reduce poverty, that great health hazard. We need to ensure people who are seeking income support get a fair and accurate assessment of their needs, and that we only use sanctions in a fair and proportionate way so that people are not pushed into more severe poverty. Of course, I don't let the NHS itself off the hook. It has to play its own part by using technology and innovation to provide better services for less cost, and all staff should be involved. Getting it right first time is the mantra of a number of groundbreaking hospitals that have shown that it is cheaper in the long run to provide excellent services first time round rather than have a lot of readmissions. Virginia Mason Hospital in Seattle, which Norman visited last year, reduced complaints and readmissions by implementing a new system of self-directed continuous improvement, which saved money and delivered safer care all in one go. I welcome the fact that 5 UK hospitals have set up partnerships with Virginia Mason, one of the best hospitals in the world. And there are some excellent UK partnerships where other hospitals are learning from top performers, such as Salford Royal, QE Birmingham, and Guy's and Thomas's. And I hear that Birmingham Children's Hospital does not use agency nurses at all. That's what I call good planning. Clearly, we need more such excellent managers in the NHS to support the clinical staff. Prevention must also be seen as the responsibility of everyone. Whittington Health in Islington, led by our own Steve Hitchens, has taken a lead here. They have shown that hospital admissions can be reduced by ensuring that all their clinicians go out into the community to add their expertise to that of carers and GPs. We must remove the disincentive which prevents clinical conversations between acute and primary care. Finally, we need a complete overhaul of patient discharge and transfer arrangements, which are, according to recent reports, an absolute mess. I'm delighted to learn that Paul Burstow will be leading a commission on behalf of NHS providers to identify and disseminate best practice on transfers of care. So, if health is a whole government issue, it requires proper oversight. And therefore today, I am calling on the government to beef up the Cabinet Committee on Health to ensure that all government policies contribute to the better health of our population. Currently, there is a small committee without teeth. This won't do. I believe it must involve all relevant departments at a senior level. The committee should conduct a review of how policies impact on the nation's health and come up with an action plan, including a cross-departmental child health strategy. Every policy should be scrutinised to ensure that it contributes positively to the great objective of a healthy society. There can be no better focus for a government if it is truly concerned about the well-being of its people. But given the challenges to the NHS, I also support Norman's call for an independent commission on a new funding settlement for health and social care. These are the obvious steps if the NHS is to remain a universal service free at the point of need and the envy of the world. Fellow Liberal Democrats, the NHS is supported by the whole nation. It must be supported by the whole government. Let us not leave it to the goalkeeper. Let us ensure that the whole team contributes to winning the cup. Thank you.
Thank you very much. Thank you very much, Joan.